Hello, dear students. Once again, welcome to our classes, which we are having a concise classes of communicative English. So today, we are going to talk about Introduction to Lsrgw. So this is a new concept which has been added by Indian Nursing Council. So we should understand that what does this mean, Lsrgw? Though we were talking about these things earlier also, but now we are being more focused about these things. So this is the whole interpretation of Lsrgw. L stands for listening. S means speaking effectively. Reading to comprehend the message in a proper way. Grammar. We are taking care of the proper grammar and avoiding the grammatical errors to make our communication effective. And W stands for writing, because communication depends mainly on writing, specifically when we talk about our healthcare professionals and we have to exchange the reports. So that is the meaning of Lsrgw. So today we're going to focus on one of the very important aspects of this, that is listening. What do we understand by listening? It is being considered as one of the very important interpersonal skills because we have to interpret the things and respond to the things appropriately. See, if I ask you, what is the difference between hearing and listening? Both these words sound similar, but they are not similar, my dear students. Hearing is when you are sitting in a classroom, you are hearing the sound of some bus which is passing by, the adjacent class which is making noise, the teacher teaching in some nearby class, or the whispering of the other students. All these things are the sounds, but you are hearing those. Listening is considered as an interpersonal skill, and you are interpreting as per this skill. So when the teacher is teaching in the class, though you are hearing many voices and sounds nearby, but you are listening to the teacher. So that is the skill because you are more focused on one particular sound. So that is the difference between hearing and listening. There are various types of listening. Many a times we do not pay attention to what these listening things are. But I'm just going to give you very brief things that what are the various different types of the listening. See, discriminative listening. Discriminative listening is when you are listening to something and maybe it is the sound of your sister, your brother. You can discriminate when the person is talking. Maybe it is telephonically. You can make out that who is talking. You can discriminate the things. Comprehension listening. I believe this is a very important listening because here we are talking about the whole content. We are having the complete information in this comprehension listening. Then we are having critical listening, in which are listening to the things, but we are being very critical in that. We are building our opinion. So that is the critical sound of type of listening. We are having a biased learning. In biased learning, it means that you're having your own stereotypes. You are having your own thoughts about something. So, this is you're having your old beliefs, and based on that, you are listening. Okay, this person is not that good in this topic, and then you're listening. So, your listening is being affected by your this stereotype. So, this is a biased type of listening. Then again, this is an important thing, evaluative listening. This is the listening in which you are trying to evaluate what is good, what is bad, strength, and weakness. This is building your evaluation. This is evaluative type of listening. Okay, appreciative listening. This is something in which you are listening as per your choice. Okay, you want to listen to a good song. Okay, you want to listen to a good poetry because you appreciate that thing. So that is your choice. That is appreciative type of listening. And in our healthcare professionals, we are having this sympathetic listening. Sympathetic listening, you are listening to the person and you are trying to understand what the other person is saying. That is a sympathetic way of listening in which you're not showing any nonverbal cues that you're in a hurry. You are trying to understand the person. So that is a sympathetic. It is really important. But on top of that, we are having this empathetic listening. So I believe These three type of listenings are really very important for our healthcare professionals. So in this empathetic listenings, you are more soaked into the person. You are trying to hold the person, trying to give comfort to the person while listening. So when you are more soaked in the experience of the person, that is the therapeutic type of listening. So here we are having these various types of listening. Now, the thing is that how we should focus on the listening. So, students, listening is an important topic. If I tell you, when you go through, definitely most of you will be going through the IELTS module. And in that IELTS, listening is a very important thing. And believe me, listening is that part in which you can score maximum. So, listening, in many times, you will see the students are scoring 9 bands in IELTS in listening because this is something which you can do it very nicely if you have focus on these things, and it is very scoring. It can definitely upgrade your score in that. So let's see that how we can improvise in a listening skill. We have to avoid any distraction. If I focus on the things when you are doing your listening module in the IELTS, you have to, how you can avoid any distraction. Distraction is in general conversation, any sound is coming from outside. Okay, you can close the door, the sound will be, you can avoid, you can close the windows. That is the outside sound you can take care of. But sometimes there is inside clutter which you have to focus on. And in your exams, let's say in the IELTS thing, there is no outside sound. So you need not to bother about that. Your main focus is inside clutter. Some thoughts are going on. Some inside you are having certain, maybe it is anxiety or anything. So that inside distraction is there. So you have to avoid any distraction. You can have a deep breath, 2, 3 breaths, so that you can focus more in that. So you have to avoid that irrelevant thoughts also which are coming. And then you have to focus on the content listening. See, in the last slide, we talked about the comprehension, right? So that type of listening we have to see here. That is a content listening. What the person over there, if you are listening, the two people are talking, there's some conversation going on between a student and a professor, what basically content they are talking about. So that thing you have to focus on and focus on the context, that what is a unique thing they are talking about, that you will see later on the questions are being asked about this thing. So there you have to pay attention. Understand the voice tone, because you are not in the module, like the way I'm talking about, you are not seeing anything. There is no visual thing which you are having. You're just having the headphones and you're listening. So you have to understand the voice tone, whether it is angry, it is happy, it is an elated mood, what sort of thing is there. So you can interpret the things according to that. So understand the voice tone and then try listening the emotions experienced by the speaker. You can very well understand. You can, sometimes you may have seen this thing that when you're talking to your friend on the phone, you can very well make out your friend is happy, elated, depressed, angry, sad. So this is where you are understanding the emotions which are experienced by the speaker, how the person is showing the emotions via speaking. Another thing is, in general conversation, if we are talking about the hospital setting, maintaining eye contact is very important. In a previous lecture, we studied this thing that maintaining eye contact with your patients, it shows them that they can confide in you, they can have the trust in you. If you're losing the eye contact, this means that, okay, you're hiding something. So make eye contact when you're listening to the person. Pay attention to the body language, how the person is saying. Like, if you're talking to the person, you're saying, how are you? How was the last night? The patient may say, yeah, it was good. But the expressions of the patient, the way the patient is saying this thing, that conveys some other story. So it is not only that you are just concentrating on what the person is saying. So that is why listening is really important, not only to the verbal thing, but to the non-verbal things also. Small verbal encouragements here, like when you're talking to the patient, it is really important that what the person is communicating to you, and you want the patient should talk more, so that because your care is building on what the person is saying, you need to understand the person. Therapeutic care is based on what the person is actually experiencing. Small verbal encouragements, like in between the conversation, you are saying, yes, go on, exactly, right. So these are considered as a small verbal encouragements which make the person to add on more what the person is saying. Ask the open-ended questions. Now, if you're just asking, if I come to your class and just say, okay, did you have the breakfast? What your answer is going to be? You are going to say yes or no. That's it. Then conversation is over. But on the other hand, if I'm asking this open ended question to you, that what you had in your breakfast. So at that time, you're having the variety of things which you can tell me. So that is the thing, how you want to extract more information. So more information can be extracted by asking the open ended questions. So these are the ways how we can focus on the listening and we can comprehend more from our patients. Now, one of the important thing is reproducing the verbatim. So what is a verbatim? So this is something when you are exactly comprehending the message, how it is being said by the speaker. In that, the speaker may say some words, there may be jargons, there may be technical terms, or there may be slangs, mm, uh, like these type of things in between which they are coming. So when you are verbatim, you are reproducing, that is in the exact form. That is a reproducing of the verbatim. Whereas the non-verbatim, that is more of the filtered thing, which means you are avoiding any jargons which the person has said, and you are also removing those slangs, these sort of things. So when you are extracting that information, that is a non-verbatim sort of thing. So you can have reproduction of both the things, but exact verbatim means when exactly what the speaker has said, you are writing that thing. So, dear students, this is a very short and concise lecture related to listening. So, I hope when you're focusing more on these things, you can really score well in your IELTS module also. And yes, you can build very good relationship with your patients and other healthcare professionals by listening attentively. Thank you.